Hey everyone, our project is on necrotizing fasciitis, and it's by Greg Hill, Jackie Lynch, and Caitlin Datto. Um, so I'm Jackie Bench, and I'm going to start with the etiology of this disease. So it's caused by minibacterium, but really it's caused by two types of bacterium mainly. And the first one's streptococci, mostly Streptococcus pyogenes and Streptococcus aureus. And it's also caused by staphylococci. I've added a couple of gram stains to this, and so you can see the one on the right is the one that looks like chains is streptococci, and the one on the left that's kind of bunched together is staphylococci. This cell is gram positive, and its morphology is coccus. And so, as you can see in the cell that I've provided here, that has a thick peptoglycan cell wall, and it's shaped as a sphere, um, and it's also non-motile.
Hey everyone, I'm Greg Hill, and this is my presentation on the signs, symptoms, and transmission of necrotizing fasciitis. So what necrotizing fasciitis is it's a bacterial infection that affects the fascia tissue of the muscle, and that's just a very thick tissue that covers the muscle and serves as an attaching point for tendons, that attach it to the bone. So this bacteria gets into that tissue and it starts to deteriorate it. So it'll actually eat it away and start to separate the individual strands of muscle, which is very, very nasty because it usually leads to the muscle death of the patient who contracts it. It's very fast acting, so it's a very, very nasty disease that's quite detrimental to people unfortunate enough to contract it. That being said, necrotizing fasciitis is actually a very rare condition. There's only a handful of cases reported in the United States every year, and most of them are to people who have compromised immune systems. Usually these people will have histories of chronic diseases like diabetes or cancer that kind of destroys their immune system. Other people who are susceptible are people who use drugs and alcohol, which is another good way to kill your immune system. And occasionally it does occur just out of the blue to people that are otherwise healthy. They don't really know why, it just kind of happens, but there's a very, very low chance of actually, having that happen to you. Now we're going to look at the signs of necrotizing fasciitis. So what a medical sign is it's a kind of an indicator of a disease that can be physically quantified. It's something that can be measured like, temperature. Necrotizing fasciitis usually occurs at the site of a physical trauma. Usually it's some sort of break in skin, such as a puncture or stab wound. That just opens up kind of a nice channel for the bacteria to get in, to get down into that muscle tissue, and really start attacking that fascia. Sometimes, it occurs because of a burn or a scrape or even an insect bite, but those generally aren't the case. Inflammation of skin tissue is a pretty good indicator of necrotizing fasciitis. Patients will also usually run a fever, and most of them will become tachycardic, which means that they have a very high resting heart rate. So here are the symptoms. Symptoms, on the other hand, are things they can't really measure, but are indicators of a condition. One of the most common indicators of necrotizing fasciitis is the development of black spots, or these kind of nasty looking blisters. So you can see down there in the picture, that's very indicative of the disease. The skin will also become really, really warm to the touch. It becomes swollen and it changes colors as the bacteria actually starts to decompose the tissue. Then, as with most bacterial infections, patients present with diarrhea, vomiting, fever, fatigues, and chills, which are all just kind of preventative measures that your body takes to try and rid itself of that bacteria. So now we're going to look at how necrotizing fasciitis is transmitted. So how these people actually get it. The bacteria that causes necrotizing fasciitis is naturally found on the skin or in the throat tissue of some adults. This bacteria is actually this exact same thing that causes strep throat, and the condition results from that bacteria getting in places where it shouldn't be, like through a cut. That kind of pushes that bacteria down into the muscle tissue. So obviously, being an infection, you can get it if you are in direct exposure to people that have it. That being said, it takes a pretty good amount of exposure for that to happen. Other times it will occur in intestinal injuries, such as a gunshot wound or a tumor. When they go to excise the tumor, that bacteria will get in there. Other times it will come because of injuries that get in contact with seawater, or injuries resulting from sea animals like lobsters and crabs have been known to cause it in rare cases. And then in very, very few cases, it'll just kind of present as a muscle strain or bruise, even if there's no break in skin. So that's kind of everything about necrotizing fasciitis. Here are some of the websites I use to get my materials for it.
For treatment of necrotizing fasciitis, the most common treatment is strong antibiotics given through the vein. Also, a big thing that needs to happen if the infection spreads a lot is you need to remove the infected areas. This often involves removing tissue, or if it's a big enough area, like in your arms or your legs, then you need amputation. And then also many patients, if it spreads enough, need wound therapy. And I've shown a picture of this. It's kind of a cool way to just keep your wound clean and sterile and to promote healing with it. So for prevention of necrotizing fasciitis, probably the biggest one is good hygiene. In all the research I found, it talked about washing your hands, um, making sure that you just stop that bacteria from being able to grow. Along with that, taking good care of and efficiently cleaning any wounds, because this is obviously where necrotizing fasciitis is going to dwell the most. And so really just cleaning your wounds, taking care of it. And then another huge thing is to see the doctor at any first signs. The sooner you get into the doctor, the less traumatic this disease is going to be. If it just barely starts to spread and you start to notice it and you get into the doctor, then he'll only need to remove a little bit of this instead of having to go as far as the treatments we were talking about before, as amputation or removing a lot of tissue. If you get in there quickly, all that will need to happen is getting an antibiotic shot.
Necrotizing Fasciitis, Reservoir and Survivor Story, covered by Caitlin Datko. The reservoir for Streptococcus pyogenes is humans. The bacterium colonizes at the throat or on the skin, especially in the winter months. So my family's had a personal experience with necrotizing fasciitis. On October 11th, my dad sustained a compression injury on his right calf due to an accident where a car driven by a student driver jumped the curb and pinned my dad's right leg against a handrail. My mom drove my dad to the nearest hospital ER within 5 minutes of the accident. He was admitted for observation with extensive swelling to his right knee and calf. Large blisters formed on his skin, requiring frequent bandage changes. On October 15th, my dad was released to home care with Whirlpool treatment scheduled every other day to diminish the swelling. His bandages were changed every day by a visiting home health nurse. The presiding orthopedic specialist warned my parents to watch for any raised red area with a red line extruding from it, looking like a small animal burrowing under the skin. If they saw that reaction, they had to get to the ER immediately. On October 25th, my dad's primary care physician determined that she could manage the wound care and cancels the home health nurse visits and the whirlpool treatments. After examination of the wound, the nurse's assistant discovers that there is insufficient materials to rewrap the wound. She ultimately finds some Coban and gauze to rewrap the calf. Coban is used in hospitals, clinics, nursing homes, and home care to secure medical devices to a patient, secure dressings, reduce edema, and reduce post-operative swelling, and immobilize splints to immobilize strains. My dad and my mom were nervous about the application of the Coban, but since they had been told that my dad had been scheduled for a whirlpool treatment an hour later, they figured that the bandage would be replaced. Unknown to them at the time, the primary care physician had canceled the whirlpool treatment. After being informed that the whirlpool treatment had been canceled, my parents returned home. The bandage remained in place until they returned to the primary care physician the next morning. During the night, my mom checked on my dad and noted that his right foot was cold to the touch. On October 26th, my parents returned from the primary care's office in the morning as directed, and another nurse unwraps the Coban dressing. He is unsure how to care for the wound and says so. While my parents were waiting for the primary care physician, my mom looks at my dad's wound and sees a large red raised area behind my dad's right knee with a red line extending from up the back of his leg. She immediately notifies the primary care physician, who disregards the urgence of my mom. My mom insists, and the primary care physician finally relents and schedules an appointment that afternoon with an orthopedic surgeon. At my dad's 2 p.m. appointment with the referring orthopedic surgeon, Dr. Sanjay Misra, he informed my dad that he had quote-unquote dead stuff in his CAD and he would require surgery to remove it. Out of my dad's presence, he informed my mom that there was a high probability that they would have to amputate his right leg. The doctor's suspicion was that he had developed necrotizing fasciitis. Dr. Misra was able to perform the surgery at 10:30 p.m. In the first of 4 surgeries, he dissected my dad's right leg medially and laterally from ankle to just below the hip. Additionally, he quote-unquote scalloped out my dad's right calf tissue, which had already been necrotized. My dad's incisions were left to the open to be air, but packed with gauze in preparation for the upcoming wet-to-dry debridement. Again, the suspicion was that the infection was anaerobic. At the time, tissue samples were taken from the infectious disease physician. On October 27th, in accordance with the ongoing treatment plan, a hyperbaric chamber session was scheduled. The hyperbaric chamber is a high-pressure, oxygen-rich chamber, in this instance, to inhibit the growth of anaerobic bacteria, and the hyperbaric session was accomplished in the early afternoon. Just after supper, my dad experienced a severe pain in his upper chest. He was given an EKG, but it turned out to be a pulmonary embolism. He was then taken into intensive care so he could be watched more carefully. On October 28th, Dr. Misra came in to examine the condition of my dad's leg. To do so, he had to remove the surgical packing from my dad's open incisions. This is called wet-to-dry debridement. My dad says it turns out to be the most painful procedure, meaning that there was healthy tissue with feeling and adequate blood flow, and that there was no more quote-unquote dead stuff. On October 30th, surgery number 2, Dr. Misra uses the surgery to close up the incisions on both sides of my dad's thigh, all clean and healthy tissue. On November 2nd, surgery number 3, Dr. Misra works on my dad's right calf, placing micro stitches on the medial side to help reconnect the muscle tissue. That proves to be the most successful since his injury. He can now move his foot in all directions. On November 6th, surgery number 4, a reconstructive surgeon takes a large patch of skin on my dad's left thigh to seal up the lateral side of my dad's right calf, which has been open and missing skin since the first surgery. On November 7th, the wound team visits and wants to try a new vacuum bandage to help heal my dad's calf. They install a machine which helps the drainage of the wound and speeds recovery. Negative pressure wound therapy is a therapeutic technique using a vacuum dressing to promote healing in acute or chronic wounds. It promotes wound healing by applying a vacuum through a special sealed dressing. The continued vacuum draws out fluid from the wound and increases blood flow to the area. On November 18th, sufficient healing has occurred for my dad to be released from the hospital. And on November 25th, my dad takes his first steps since the accident. Now, these are pictures of my dad's legs nearly 15 years after the accident, and you can still see the effects of necrotizing fasciitis has had on his leg. And this is my bibliography.